it is time to look into the future and to solutions. One of the best opportunities that we have as a global health community is to engage more fully in the climate change dialogue. And so much of that dialogue happens, as we all know, during the annual United Nations Climate Change Conference. And so this year's conference, or COP28, as it's known, will of course occur right here in the United Arab Emirates. We are privileged today to have with us the Director General of COP28, His Excellency Majid Al Suwaidi. Ladies and gentlemen, please welcome His Excellency to the stage.
Assalamu alaikum, Excellencies, colleagues, welcome to Abu Dhabi. So pleased to be here with you today, and very excited about the conversation that you're having, and just heard a little piece of the discussion and already feel very excited about the work that you're doing here today, and look forward to hearing more about the outcomes of your discussions. COP28 will deliver the first ever global stocktake where the world will come together to assess progress made towards the Paris Agreement goal of limiting global warming to less than 1.5 degrees C. It will reveal the gap in ambitions and reality. We are likely to be off track. The world needs more course corrections. The COP28 UAE presidency will work to ensure that together we urgently accelerate action to get the world back on track by 2030. The challenges we face are enormous. To meet our targets, we must cut emissions by 43% in less than 7 years. In order to drive healthcare systems, adaptation, prevention, relief, and recovery for affected populations. We must work together to ensure that this COP of solidarity, which bridges the global north and south and brings in all stakeholders, including the private sector, scientists, civil society, indigenous peoples, women and youth, and leaving no one behind. Through an inclusive approach, we hope COP28 can find solutions and outcomes across healthcare, mitigation, adaptation, loss and damage. The COP28 presidency is focused on working with the UNFCCC and the Egyptian presidency to scale up mitigation efforts to keep 1.5 degrees C alive by delivering concrete and pragmatic decarbonization solutions and driving investments to decouple growth and development from emissions. Underpinned by a global effort to cut emissions by 43% by 2030, we need to triple renewable energy capacity, double hydrogen production, expand nuclear power, improve battery storage and scale up carbon capture technologies, while minimizing the carbon intensity of today's energy and transforming food and agri-systems which produce 1/3 of the world's emissions. Given the high and growing impacts of climate change on the health and well-being of our societies, COP28 has identified health as a priority and is committed to advancing the integration of the health and climate agendas and mainstreaming health from air pollution to communicable diseases. The COP28 presidency endeavors to deliver a solutions-oriented COP that will help safeguard the health of people and the planet. The World Health Organization has identified climate change as the single greatest threat to humanity, with grave implications for our planet and people. Climate change is now threatening the progress we've made in global health over the past decades. And COP28 is an opportunity to catalyze global health, expertise, innovation, and finance to ensure we leave no one behind. Global health is our first line of defense against the climate crisis. From a rise in heat-related deaths to the increased probability of extreme weather events, climate change has significant impacts on our communities, as these events devastate local food systems, livelihoods, and leave millions of vulnerable people without food and clean water. Warmer climates can increase the geographic spread of disease with the potential to expose billions more people by the end of the century. Climate impacts can also increase healthcare costs, deepen existing inequities, and cause disruptions in healthcare access and quality. And we want to address and prevent impacts of climate change on health. If we want to address and prevent impacts of climate change on health, what actions can we as a group agree to work on for the next 8 months and the way to COP28 in order to help those countries and communities that are impacted the most? While the COP process cannot solve all the challenges, it is an important vehicle for establishing political consensus on climate change and its impact on health. We need to begin actively bridging the staggering gap in climate finance flows for health. Currently, only 2% of adaptation funding and 0.5% of overall funding from multilateral climate finance sources is allocated to projects that explicitly aim to protect or improve human health. And this is still happening despite the majority of countries identifying it as a priority sector. The UAE and 60 other governments have committed to develop net zero, climate resilient healthcare systems through the Alliance for Transformative Action on Climate and Health. Our conversations today at the Forecasting Health Future Summit and our work together in the lead up to COP28 can help to realize the ambition set by this alliance to build climate resilient and sustainable health systems using the collective power of governments and other stakeholders to drive this agenda forward at pace and scale and promote the integration of climate change and the health nexus. It will also be important to bring together the private sector and public sectors to fund national plans and implementation of climate resilient healthcare systems, to move from commitments to action. We will create space for health issues and topics within the context of climate change, from adaptation, mitigation, and resilience aspects at an unprecedented level. We will have a health day at COP28, and we will work with member states and partners to ensure that we're breaking down silos and bringing together ministers, policymakers, and practitioners from health, finance, climate, energy, and other sectors together. These ideas are, of course, just the tip of the iceberg. Working with the UNFCCC, the COP27 presidency, and of course all of you here, we hope to identify the issues that we can agree on and work together as a group. So I'd like to invite you all to work with us to provide a clear, achievable roadmap from the Forecasting Health Future Summit today to COP28 that brings together a diverse range of stakeholders from the health sector to ensure that public health is elevated in the climate agenda and is leveraged as a moment to make progress on climate resilience of healthcare systems. I thank you very much for your time, and I really look forward to the outcomes of your discussion. Thank you so much.
Thank you so much, Your Excellency. Thank you so much for that, Your Excellency. And as we can see, the UAE truly is extremely well placed at this critical juncture to host the COP28 meeting, and we are excited for that because if any country can bring the world together, it is definitely the United Arab Emirates. Amazing. And so if you haven't done it already, this is a little bit of a reminder to download the app, the FHF Global Summit app. If you haven't already got it, you can scan the QR code, update your profile, and there are some incredible people in this room that you want to be connected with, and that is the best way to do it. They can find you, you can find them, and we can all interact and see all of the fantastic things that are coming up on the agenda over the next few days as well. But also to align and work together in the lead up to COP28. And so now, everybody, it is time for our first break of the day. It is time for some tea and coffee, which is right outside the doors of the ballroom right here. But if you could make it back here by 11:30, we have our first solution spotlight of the day, one you do not want to miss, and it is all about changing education needs for a climate resilient health workforce. So enjoy